And good evening, everybody. Welcome to this meeting of folks in the Southern Oregon Phoenix Talent area to discuss the very important topic about our health in the aftermath of fire. My name is Lisa Arkin. I'm the Executive Director of Beyond Toxics. And my counterpart, Virginia Camberos, Director of Unite Oregon, is unable to make it tonight, but Erica will make some introductions about Unite Oregon and their role in this project. So Beyond Toxics is an environmental justice statewide organization. We have offices in Eugene and Lane County and also in Phoenix in Jackson County. We have a wide variety of issues and topics that we work on with our staff of 9. And a core part of our work is to make sure that the community health, especially those communities that are most vulnerable, people of color and Native American communities, low income and rural communities, are protected from pollution and toxics that can cause lasting harm to our health and to our environment. And that's why this project tonight is so important, because we're going to be addressing the impacts of air and water pollution from the catastrophic wildfire that devastated the towns of Phoenix and Talent last year, and to acknowledge those families that were made homeless from the fire and what they might have experienced immediately after the fire and may still be experiencing. So tonight we're going to learn about the toxicity that might be in our air, water, and soil, about our health, and about what we can do about it as a community in an upcoming project. And so at that, I'll turn it over to Erica to introduce Unite Oregon.
Thanks, Lisa. Hi, everybody. In name of Unite Oregon, I just want to welcome everybody. And as Lisa said, we, Unite Oregon, have our main office in Portland, and we also have 4 different chapters, one in the Rogue Valley, which is where I'm at, one in Multnomah County, one in Washington, and one in Clackamas. Unite Oregon is actually led by people of color, immigrants and refugees, rural communities, and people experiencing poverty. We work across Unite Oregon to build a unified intercultural movement for social, economic, and racial justice. And I am actually going to present in Spanish as well. Hola, buenas tardes, bienvenidos a todos y gracias por estar aquí. Solamente quiero agradecerles en nombre de Unite Oregon por acompañarnos esta tarde a esta junta tan importante, y quiero hablar un poco acerca de Unite Oregon. Como ya sabemos, nuestra organización está basada en Portland, la oficina principal está en Portland, pero también tenemos 4 diferentes capítulos. Uno en el Valle del Rogue, otro en Clackamas, en el condado de Clackamas, otro en el condado de Washington y otro en el condado de Multnomah. Quiero decirles también que Unite Oregon es dirigida por personas de color, inmigrantes y refugiados, también comunidades rurales y personas de bajos ingresos. Nosotros trabajamos a través de Oregon para construir un movimiento cultural unificado para la justicia social, económica y racial. Gracias a todos por estar aquí. Thanks everybody for being here.
Thank you, Erica. We'd like to move right on to our 2 guest speakers tonight. We have Dr. Andrew Whelton from Purdue University as our first guest speaker, talking about impacts to water quality. And following him is Chris Ryan from Advantage Environmental, and he'll talk about the work he did in the aftermath of the fire, the Alameda fire, testing the soil and other constituents for the US EPA.
Appreciate being asked to talk with you tonight, and I'm very sorry for all the wildfires that are happening out west in affecting your communities. I've been involved in several fires responses the Camp Fire, the Tubbs Fire, both of those were in California. I was contacted by several people out in Oregon with the Almeida Fire and some other fires. I just, a couple weeks ago, helped people out in Whelton, British Columbia, who had fire go through there. And then also last year with some of the other fires, the CZU Lightning Complex Fire and some of the others. So the reason why I get involved is because of my background finding water contamination and helping people figure out what to do about it. To kind of start this off, I was asked to talk about, what are the things that maybe you should be aware of. I have interacted with the Oregon Health Agency. They have been very proactive compared to some of the other states that I've interacted with. And it comes down to, where do you get your water from? So when a fire comes through a community, it doesn't just go to downtown Main Street, right? It affects the communities that people rely on private wells. And so the fire can come through and damage these wells and the plumbing and the pipes that are on that property. When you get towards larger communities, you have water delivered through buried pipes, and these pipes then deliver it to homes or commercial buildings or schools. And you have a lot of buried infrastructure, but you have the same situation where you have plumbing. And so fire damages these systems pretty much the same. It's just, they're just different structures. Many of the same materials that are used for homes that have wells are used for homes that have water coming from a utility or some type of water system. Now, after the fires in 2017, the city of Santa Rosa discovered hazardous waste scale contamination in the city of Santa Rosa's water system being delivered to homes that were still standing. And the city of Santa Rosa had a lot of money, and they had their own government testing laboratory in town. So they basically spent a lot of money to do testing and figured out that they do have a problem. The year after that, the Camp Fire, or 2 years later, the Camp Fire occurred in California. And that again precipitated hazardous waste level contamination of drinking water systems in multiple systems, not just one. And so my team here at Purdue tried to figure out exactly where is it coming from, because many people really hadn't thought about it before. So we went in and we did testing. We also worked with the community, which was how we were able to really help a lot of people. And then we came back to Purdue in Indiana and we tested plastics. And what we found out that is that if you heat up plastics, the pipes that are in the ground or at the water meters or in the buildings, they actually can generate contamination that's not there if you just put like tap water through it. And then that can cause hazardous waste level contamination. We also know that some of the contamination comes from smoke. So when you have a fire in a town or a building, you'll have a water break and all the water on one side of the house rushes to the other. And if there's a pipe, like a faucet that's open, it will suck all that smoke into the pipe and then drag it down through the pipe. And so that's another reason sometimes why people can have contamination in their plumbing. And so there's a video, I posted this presentation on my website for Purdue. It's it's plumbingsafety.org, and I'll show a copy of that later. There's also studies free that you can read if you're looking to see pictures or read about the chemicals or the science or what we found. We put that online too, that's all free. And there's a link here. We've also been helping out health departments. So we talked to Santa Cruz Health Department. We talked to Jackson County Health Department in Oregon. We talked to Butte County. And we kind of worked with all these different counties to put together a how-to guide. When you have a fire and you own a private well, what do you do? When you have a building that has a fire in the town, what do you do? And so we kind of put together this how-to guide. And we posted this online, it's free. And it basically goes through step-by-step process of what to do. And prior to 2017, this didn't exist. Prior to 2018, this didn't exist. And so we basically compiled this because we found health departments were being asked what to do and they didn't know. So they would tell one group of people one thing, another group of people the other. State agencies would tell people something else, and everybody was kind of like making stuff up. So this was part of the process. One of the key findings that I've had interacting with all of these communities who have had fires is that the public health departments, and some of them don't even know how important they are critically important in helping citizens affected by fire understand water safety. And there's a video online created by the CDC. It's actually pretty good. It's 3 minutes long, and you can click on this link when you get a copy of the presentation. And it talks about what public health is and what environmental health is and why they're important. The problem is public health departments are typically way understaffed. County health departments are generally funded by taxpayer dollars. And people don't like to pay taxes, therefore, sometimes that has a direct impact on who they can hire or not hire. Also, during disasters, public health departments get asked to do everything. They get asked to, oh, you need to handle the disaster debris. You need to handle the hazardous waste. We need to know what to do with it. And they get tasked on safe drinking water too. But sometimes they get pulled away from that and there's nobody to help people or answer the phone about certain issues. And they really can't do their job well unless the community is communicating with them. Otherwise, they're in a bubble, they're in a vacuum. And even though they're in these high-level meetings, maybe in the governor's office after a disaster, they can't really advise the governor like what the situation is on the ground. Public health departments also, during federally declared disasters like these wildfires, are the designated hat that is supposed to be protecting potable water. They are supposed to be out there helping the community. And sometimes they don't recognize that. But in situations that I've been in, when I've talked with governor's offices and county health department, health officers and such, you raise that up, you give them that information, and then they realize, oh, the community wants me to be out front on this, and I can help them this way. Communities that organize, that work with one another to help one another are the ones that I see being successful at recovering from these disasters. And when we went out to Paradise in California, we worked with a Campfire Zone project, a community-based group that formed after the fire. It was just people that were affected. And they wanted to figure out, how do we rebuild our community? How do we rebuild better so that we're not equally vulnerable? If you've been watching the news in Paradise, they had the Dixie fire come up next to them this year. They had some other fires in the past years after the Paradise fire came up too. So they recognize that the risk is still there, but they're working together. Public health departments, though, ultimately are still kind of figuring it out. So all the public health departments in the counties across the country don't all know the same thing. So we here at Purdue are working with the American Public Health Association, National Association of City and County Health Officials, NEHA, all these other groups to try to get them the information they need to better help communities. But sometimes they just don't know it all. In one situation, the state of California, for example, told the utility that they're responsible for providing emergency water to the entire population affected. But as it turns out, under Title 42 of federal law, Safe Drinking Water Act, the state is actually responsible. So it was a political decision to push it down to the utility level and not accept that financial responsibility on the state. Now, county health officers, public health officers, they don't know this detail, but these types of details help when you're arguing for our community needs support. This is the mechanism by which you should provide it. You can provide that information to your elected leaders, and then that kind of opens up the floodgate. So with that, I'll just turn this back over. We do teach a course here online for public health officials. So if you know public health officials that are looking to understand building water systems, this is what we do here because most of them don't know about it. We also have a project funded. We're working with multiple utilities because after the Camp Fire and the other fires, and they saw kind of how some government agencies came in and told them what to do, even though it wasn't correct, they got a little scared. And so they are very concerned about making sure that the decisions they make are in the best interest of public health and safety. And that's some of the work that we're doing here. And I will stop and share my screen. Thank you so much for the opportunity to talk with you today. And thank you.
Okay. Muchísimas gracias.
Chris Ryan of Advantage Environmental Incorporated. He's got a presentation for us as well. Chris, you're still muted. We cannot hear you.
Is that better? Can everyone hear me now?
Yeah, much better.
Good.
Thank you.
Okay. My name is Chris Ryan. I'm with Advantage Environmental. Been in the environmental industry throughout the Northwest for the last 20 years. And I'm here to talk about a few of the things that we look for in a residential fire as far as testing for hazardous materials. So let's go ahead and start this. All right, can everyone see that all right? Hopefully. So this slide is a typical residential house fire. One of the major concerns for most residential house fires are the materials that burn during the fire. Those materials range from plastics, metals, paints, solvents, fuels, carpeting, roofing tar, and asbestos and lead. The off-gassing of those materials are called polycyclic aromatic hydrocarbons, or PAHs, and they have an effect and can be found in areas of wildfire and house fires. The next slide is an overhead view of one of the Valley's mobile home parks shortly after the fire. A vast majority of these parks and homes were built prior to 2004 and very likely to contain asbestos, lead, and other potential toxic materials. This next slide, we see just the frame standing from one of those homes. But where did the rest of the material go? It has been reduced to ash and dust particles. These particles are a mixture of the combined contents of the home and the materials used to build the structure itself. The problem that we faced in situations is that any toxic material or byproduct does not stay just on the property, but has the ability to migrate to other properties. This next slide is cement asbestos board. It's a siding that was used and more likely than not covered in lead paint. Notice how the structure is completely burned to ash, leaving only the siding behind. What is unique to this disaster is that the fire burned at such a high temperature that it literally vaporized most building materials and household items, leaving just the siding behind. The reason for that is that asbestos is heat resistant. In fact, it's more resistant to fire than most residential building materials. This means that when most other materials are reduced to ash and the asbestos is all that remains. Let's look at some of these hazardous materials under a microscope. This is chrysotile asbestos, the most common type of asbestos used in building materials in the United States. This next slide is silica dust and shows the wide range of particle sizes in crystalline silica structures. A study was performed in another state on workers during the cleanup after wildfires, and some employees were found to be overexposed on silica and PAHs. This next slide is an image of toxic metals, cadmium, zinc, and copper specifically, as well as lead. As you can see in the size comparison, these toxic elements left in the aftermath of a fire are impossible to identify without the use of a microscope. Even with the use of a microscope, this task becomes difficult when you account for all the other particulate matter that is collected during the bulk sampling process. Most inspectors are trained to recognize materials as they are installed on the building components themselves. When you have reduced the building to ash, this becomes like trying to find a needle in a haystack. Here's a size comparison up to a human hair. So as you can see, what you would think is extremely small, human hair, glass fibers are that much smaller, and then asbestos beyond that, and then fume particles. This slide shows the EPA's cleanup effort of a property that is listed as free of hazardous materials. During the cleanup, in most cases, the EPA is performing air monitoring on employees and the perimeter of the project site. The type of air monitoring that is being performed is a PEL, or negative exposure assessment, to this permissible exposure limit. That type of testing is based on seeing if the employee is exposed to or above the PEL. What we are concerned about and looking for to perform testing is for low-level, long-term exposure of various hazards that we discussed earlier. Some of these hazards can also be absorbed through the skin, such as these batteries in this slide. At first thought, you may think it seems harmless to scan or sift through the debris until you realize what you're getting into, and having this information may have swayed your decision. On a typical construction site, where these hazards have been identified prior to the construction process, you would expect to see signs like these for silica, asbestos, and lead. Now let's think back to that mobile home park. The prevailing thought behind the EPA rulemaking is to look at each property as a single cleanup effort. So that mobile home park, if that mobile home park had elevated levels of any hazardous materials mentioned above, the EPA would consider the entire property to be contaminated. And that makes sense under normal conditions. But these are not normal conditions. Now let's look at a typical residential neighborhood in the Phoenix Talent area. What is the difference? Nothing really, just that these are all individual properties. This means that the EPA has inadvertently set a different set of standards for regulating the problem. If you have 50 homes in the mobile home park and 10 of them test positive for hazardous materials, the entire site would be considered contaminated. Now, if you have the same 50 homes in a residential neighborhood and 30 of them test positive, only those 30 would be considered contaminated. What this does is leave pockets of neighborhoods without any air monitoring or any air data being collected to know the real world hazards. Even in the areas known to be hazardous, the standards set by the PEL for workers do not address acute long-term exposures. All we need to do is look at Libby, Montana to understand the unfortunate effects of overlooking long-term exposures. Libby, Montana was famous for having a vermiculite mine. And part of the side contamination of mining vermiculite is there is some level of asbestos. That asbestos is less than 1%, which is the regulated limit that the EPA has set, leaving the residents of the town to believe that they were perfectly fine and had no danger. But what they found out was that over time, these residents of the town started developing asbestos-related illnesses that were previously only linked to high-level exposures. And after probably 5 or more years of researching the issue and a lot of air monitoring, they determined that it was the acute exposure over a long period of time had the same effect as a heavy exposure over a short period of time. This is a picture of an EPA site that had been deemed complete. When the EPA came in to clean up these properties, these were the visual items that they could see when they showed up to the property, such as propane tanks, solvents, paints, and large pieces of asbestos that they could see. That said, most of what we're worried about are the things that you can't see. In closing, I'd like to say that if anyone has learned anything or found any information that we've given to you today to be helpful, please share it with your friends and neighbors so that they can understand exactly what's going on here and be prepared for entering their property post cleanup effort. Thank you very much.
I'll be the next person again. I'm Lisa Arkin, Executive Director of Beyond Toxics. And after you've learned what's in our air, soil, and water from our 2 guest speakers, I want to talk about, are we doing enough? And how can each of us learn more about how these pollutants can enter our body and interact with our health, our organs, our bodily system. So Wendy, go ahead if you wouldn't mind sharing. So what about our health? And go ahead and go to the next slide, please. So I bet a lot of you are here joining us today because you are concerned about wanting to ensure that you and your family have clean air to breathe, have clean soils, and safe food. Great question about growing vegetables, and safe drinking water. And everything that goes on in our environment post-fire will have an impact on ourselves as residents continuing to live in those communities. Next slide, please. So this is a kind of a recap of Chris's slide about how these very tiny particles that might have asbestos fibers on them or silica molecules, particles, or heavy metals can enter our body. So something called particulate matter, those small, tiny particles that are much smaller than a human hair. So there is a picture of, if you took a microscope and looked in on the size of a human hair, what it would look like, and you can even feel your own hair and think how small that is. These particulate matter particles are so much smaller. The little red dots represent particles that are 2.5 microns, and the blue little dots represent particles that are 10 microns. Either way, they're very, very small. They're smaller than fine beach sand. And so we don't see them. We see the soot, we see the smoke, but we don't necessarily see these tiny particles. And why is that a concern? In the next slide, please, we'll see that these tiny particles can go deep into our lungs. We breathe in the air, and this causes inflammation and congestion. It can make us cough. It can make us have trouble breathing. It can lead to onset of asthma or asthma attacks. It can contribute to chronic bronchitis if you're exposed for a while over time, and can exacerbate conditions like COPD. And over time, medical scientists have shown that breathing in polluted small particulate matter can cause lung cancer. And so try to picture that every breath you breathe in, and you might want to take a big breath and just feel it going down into your lungs. If that breath is full of these tiny particles that have stuck onto them, asbestos fibers or benzene molecules, those go deep into your lungs and exchange at the very place where your lung is delivering oxygen to your circulatory system, to the blood vessels. And so when this exchange happens, those small particles can then enter your circulatory system. And this is where the junction happens between breathing in air and giving nutrients to our body in the form of oxygen. That then goes directly into our bloodstream and is carried to our heart and every other organ of your body. Next slide, please. And there you see the heart there right in the midst of the lung tissue. And so when wildfire smoke contains high levels of these small, dangerous types of particle pollution known as PM 2.5 or PM 10, these can be specks of toxic soot. They're so fine that they embed deep in the lungs. Again, they pass into the bloodstream, just like oxygen molecules, and they can be carried to the heart where they can contribute also to stroke and heart disease. So not only lung problems, but also possibly heart disease. And the next slide, please. So again, one more way of picturing it, we breathe in, things go down into our lungs, they go down into our bronchial tubes, they cross into our circulatory system, they are carried throughout all of our body through the blood, and they can even cross into the brain, and they can even cross into the placenta. And thus, what we're breathing in, if you're a pregnant woman, what you're breathing in can cross into the placenta in the womb where a baby is developing and can potentially cause harm to that baby as well. And there's plenty of medical research showing all of us that air pollution takes a particular toll on pregnant women and the developing baby. It can increase the risk of complications during pregnancy, and it can increase the risk of premature birth, low birth weight, and cardiac defects or heart defects in babies. So as our lawmakers, our communities, our environmental agencies get to work on protecting public health from pollution, they really need to stay focused on the health of the people of Oregon. And I think this follows up very well from what Andy and Chris were saying, that in these cleanups, we need to clean up to a degree where we're protecting health. Next slide, please. So even after the fire, if there's particulate matter in the air, if it's dust being carried up by wind, we can be exposed to it in our everyday lives. If you work outside, you can breathe these air particles while working. Next slide, please. You can absorb them through your skin if you're touching polluted soils or other polluted materials in the aftermath of a fire. Next slide, please. You can breathe them even inside your home if your home is not very airtight. These small, tiny particles can come in through windows, through doors. Every time we open a window or open a door, letting the kids in, letting the dogs in, these particles can come inside your home. They can settle in your furniture and your carpet. And then as we kick up that dust in our daily life, we can continue to breathe it, even inside our homes. So protecting the indoor air is just as important as protecting our outdoor air. And next slide, please. And as we learned from Andy, we can also absorb these chemicals into our body through drinking water that has toxins that have entered into our drinking water system. Next slide, please. So again, the polluted air from wildfire smoke can harm unborn babies. And the research shows that after a full week of exposure to smoky air from wildfire, there's more than a 3% increased risk of premature birth. So especially if a woman is in her second trimester between 14 and 26 weeks of pregnancy. So again, very important to stay safe in all the ways we can, especially for pregnant women. Next slide, please. So we can never be careful enough. Being careful protects the very youngest, even those who have not been born yet, our children who play outside, who put their fingers in their mouth, who breathe dust because they're closer to the earth. For elderly people who might be more at risk because they already have pre-existing heart or lung conditions. And for communities of color who often have jobs that take them outside to work or don't have the healthcare, access to healthcare that others have, or again, might have pre-existing conditions. Next slide, please. So in closing, we just want to share our desire to work with the communities of Phoenix and Talent, Medford and Ashland, with our partners, Unite Oregon and Unite Farm Worker Advocacy Center, Grow Climate. All these groups are going to be reaching out to you soon to show you how to get involved in an upcoming project. And so I know Erica and Wendy are going to tell you all about it. Thank you very much for being here tonight. And I'll turn it back over.
Muted.
Yeah. So actually, yeah, we're waiting on the results for those purifier filters. I wasn't aware that Pam had been the one that turned those in. We were talking about that prior to this. You know, asbestos is definitely going to travel the furthest. So that's something that in a controlled environment, it can take one fiber 8 hours to fall to the ground. So the likelihood of asbestos being in the air during and after the fire is pretty high. As far as it went, you know, the winds were really high during the fire too. It probably traveled all over. Was it measured? No, not at the time. Is it being measured now to some extent? But as far as, you know, lead and that toxic metals, you know, they can go quite a ways in fire or in high wind. I don't know that I could give you a strong answer on that as far as if it traveled far enough to get to your house. There's a possibility that it could. Again, it would be low levels, but what we're talking about are low levels over a long period of time. You know, again, we're coming close to the 1 year mark of the fire. I think that's what we're really focused on, is finding out what these acute levels are, what's in the air, not not right next to where they're doing a cleanup, but in the ambient air around the neighborhood itself. So instead of focusing on a property, we're wanting to test the air, say on Rose Street, off of 99. I think that was probably one of the first neighborhoods to really start getting built back. But I think there's still a lot to be done over there. I think we definitely have a great opportunity in the coming months to potentially get some information to answer that question better. But right now, I just don't have anything I can tell you as far as what type of measurable amount may have reached your property.
This year, there has been more winds than I've ever seen in my many decades in Oregon. And it's been killing trees. A lot of trees have been getting wind burned, and which is just, they just get whipped around by the wind. And I've got a 90-foot cedar tree that started dying. And I found out that it had this condition called wind burn. So I know that, the winds have been quite unusual this year. Also, a lot of mobile homes, most mobile homes have aluminum in them. And I mentioned that to Sid, and I'm curious about, what affects, burned aluminum and what that can do in the atmosphere too. So that's something I put to him and you guys.
And that's something that we're working on is, and a lot of it, we go back to Libby, Montana to kind of figure out what were the methods they were using to track these acute exposures. And unfortunately, a lot of it has to do mostly with asbestos and lead. But I think that with the Paradise Fire and some of the stuff that the EPA learned during that process, I think that we're starting to see more emphasis on heavy metal testing and the effects of burned metals, the effects of molten metals that do become airborne, like aluminum. Because what happens when they get into your lungs, they get into your bloodstream, lead is very difficult to remove. You actually build that up over time. It's not something that's passed, like most materials and things that you consume. I think that aluminum probably has a little bit less of an issue than, say, zinc. I think that we're seeing more elevated levels. Obviously, on the metals testing, we're not testing for aluminum specifically, but I think that zinc, for whatever reason, is definitely something that we're seeing more elevated levels of on these tests than even, say, lead.
Okay.
But,
all right. Thank you.
Yeah.
Thank you so much, Chris. And thank you, Pam. That was a really good question. I think it's important to consider so many angles. There's so many particulates and so much material of varying, makeup that was damaged. And you think about, it gets kind of scary to think about what we could be breathing in these circumstances. And to kind of piggyback off of that, Miguel Cervera, forgive me if I mispronounced that, asked the question, how effective are N95 masks in preventing the inhalation of particulate matter? And I saw, Andrew, that you had dropped a link in the chat there. Thank you for that. And I don't know if either one of you wants to answer that question. For the rest of us, perhaps some folks can't see the chat conversation going on.
Well, I will defer to Chris because I know he's probably worn N95s due to his occupation sometimes. So maybe, Chris, if you want to educate.
Yes. So an N95 is gonna offer you some protection. It's not gonna be to the level of say a half mask respirator with a P100 filter that you see the EPA cleanup crew wearing. It can protect, I believe, up to 1 fiber per cc, which is about 1/5 of what a half mask would do, and probably up to 1/10 of what a full face respirator would do. So you do have some protection with those masks. And I think for what we're talking about with the acute exposures, that would be the ideal situation that you'd use that mask in. Anything above acute exposure, no, it doesn't help very much for that. So if, for example, someone was on their property just after the fire and they were sifting through material and found out later that material did contain asbestos or lead, then there is a small chance that they may have been exposed above the PEL, above the permissible exposure limit. In that one instance, more likely than not, you're fine. If you were doing that on, every day for a month, there may be some concern there. If you weren't wearing an N95, you weren't wearing any respiratory protection, that could be an issue. But again, has it been measured? No one knows. The only thing that we do know are the properties and cleanups that have been done with air monitoring. And those are showing that with the adequate use of water, they're keeping that dust down. Now, that said, we know that in the 5 months after the fire, we had a fair amount of water. It was cold temperatures, everything was fine. Once May came around, we started seeing a lot higher temperatures and a lot less water use, to be honest, during these cleanups. So I think one of the pictures in the slides, that was actually taken 2 months ago. And it had the heavy equipment in there and you could see the haze of dust. Now they had water on that property and it was an EPA property. They were using it for sure, but was it adequately being used? No. And so I think that, if I was living in the area of a cleanup effort that's taking place, I would report anything. If I saw any dust, what they call visible emissions. If you see any visible emissions related to any cleanup, whether the EPA is doing it or a local contractor or any contractor, to be honest, and not even just the sites that are considered contaminated, but even the sites that have been deemed asbestos-free, lead-free, all toxics, toxic chemical, everything has been deemed free. Even on those properties, if you're seeing any dust clouds, visible emissions, that should be reported immediately because that shouldn't be happening. So I think that as we get into colder months and more rain, and you probably won't see a lot of that going on, but it's definitely something to look out for.
Thank you so much, Chris. That was a very thorough answer, and I appreciate that. And I think all of us, appreciate so much of this information, just because it's not something you think about, unfortunately, until you have to. And Helene, there's a couple I would like to take a moment to mention. There's a couple really good links in the chat that have some good reference from a couple folks who are in attendance here tonight, as well as from Andrew, and Helene just dropped a incident report link there in the chat. She also had asked a question about recommendation for testing protocols for people who in this area might be interested, and that's actually going to be our next topic. So thank you, Helene, for helping segue into that. Erica, did you want to introduce some of the work that Unite and Beyond Toxics are partnering together to provide for the Rogue Valley community here?
Absolutely. Thank you, Wendy. Yeah, as Wendy said, we're going to be working on some community surveys. And this project will basically be building science people, which will give people the skills and knowledge in the Latinx community, the immigrant, the BIPOC populations in this region, to introduce like interventions to mitigate the negative health impacts, such as wearing masks in the residential grade of peripheral air monitors and etc.
Yeah, I think, Erica, thank you. One thing that we've noticed has been lacking in some of these conversations that have taken place since the fire last year was just, checking in with folks in this community about where their health is. How are you feeling? How are you doing? Have you noticed any side effects or serious health concerns that have come about since this disaster? And do you think, or have there been any correlation there? We want to make available a survey for these communities to give people the opportunity to, speak to where their health is at now since this disaster.
Also on these surveys, we will be monitoring, or we will actually be asking for people to monitor like their people with problems for like asthma and respiratory problems and symptoms, which is basically a lot of the symptoms that people are presenting right now after the fires, like they're worsening. So we are going to also be monitoring the temperatures, the wind directions, and obviously the levels of particulate matter, like they were talking about. This is very important to know. And we are also going to be investigating about the indoor and outdoor air quality. We will have community meetings and also trainings. And we will be investigating about the destroyed properties, like they've already mentioned as well. Some of these metal buildings have toxic residues, and this will be harming not just us, but they will also be leaving ashes. They will be leaving the asbestos and the plastics as well.
Yes, we hope to, in partnership with each other, Unite and Beyond Toxics and organizations such as Advantage Environmental, we've been applying for grants, and we're trying to work with outside agencies to provide potential for particulate testing in these different mediums in our community. We want to make sure that as people are continuing to live here, that they're not just living here, but have the opportunity to thrive again and do so in a safe and healthy way. That's something we're very committed to, and that we really hope to, bring an access point to this community, is to find out, what are these residual effects that you may be experiencing? What are the effects that you may be experiencing now? We all see the haze in the air. This is becoming a recurrent situation, as unfortunate as that may be. But it's the reality that we're faced with at this time. And so we absolutely want to make sure that, as people start to rebuild their homes in these areas, as they start to come back, is it safe to do so? So that's what we're really hoping to find out. And in conjunction with that, like I mentioned, we can see things are burning again now, and it's likely that they will continue to in the future. Excuse me. And so something that we also hope to, work with these communities and work with you all as we move forward is hosting these community meetings, like Erica mentioned, providing opportunity to interact with our communities and to hear from you all, and to also work with our state agencies and our local government and our local communities to provide better and more readily available access to preparedness plans, so that if and when a disaster like this strikes again, we're more prepared as a community to respond to that, to deal with that, to evacuate from that, and to be okay in those circumstances. Miguel just dropped a really nice question in the chat. How can he get involved? Where is the help needed most to create an impact? Any of our organizations, I know since last September with Unite and Beyond Toxics, the Rogue Climate and the Rogue Action Center, we've all been pretty much working all year to work together to pool resources and come together for our community to provide, you know, access to things that people need: food, clothes, water, supplies, things like that. Erica, did you have anything you wanted to add on that? Oh, I think you're muted.
Sorry, I lost my mute button. Yes, absolutely. Well, like Wendy already mentioned, the goal for this is just to have more information for the citizens. As much as we would like to have that information available, sometimes a lot of people don't have the resources to access to it. A lot of the times we're able to reach it or find it on social media, but we have to remember that some of our BIPOC communities and immigrant communities don't have the knowledge or the access to it. So having these trainings open to the public will reduce this. It's what we're hoping.
And something that in doing so, we continue to hope to continue to provide is the option to have this information available in both English and Spanish so that it is accessible for all of our communities. Latinx community, the BIPOC community, we want to make sure that you know, everyone that's being affected in our community can you know, work with us to bring this information, to get this information out and to spread the word so that we can all work together as a community. Oh, Erica. Yeah, thank you, Miguel. And you know, as we begin to talk about resources, I'd like to go ahead and share my screen again, something that we are, you know, really happy to be able to provide is, you know, you all, if you read the flyer when you registered for this meeting this evening, you were entered into a raffle to win an emergency preparedness go bag full of supplies for a family of 4. I can share a photo of what is in that. Give me just one moment. So we will be giving this away to one of you this evening. One of our board members, Christina, is going to pick the winner, and she has this bag. And so, you know, being able to provide supplies such as this: drinking water, blankets, gloves, masks, hygienic items, sanitary items, things like that. That's something that, you know, we plan to work with organizations like Unite and Unite and beyond in the future to put together, that in the event that something devastating like this happens again, we'll be able to provide items like this for the community and, you know, continue to assist making sure that the people who need basic necessities have access to that. Let's see what's going on here in the chat. Oh, yeah, Helene, let's go ahead. If there's any more questions, we've got about 5 minutes to answer any more questions. If any of you there, I think we're gonna have Christina do the raffle and pick a winner there. For our raffle this evening. And while she's looking for those, if anybody else has any questions, please go ahead and drop them in the chat or raise your hand. Helene just asked a question. Andrew, so Helene said in the chat, Andrew, what advice and recommendation around proper testing protocol can you share with folks who are interested in testing their water?
So on the website, plumbingsafety.org, the Purdue University website, you can go there and there is a how-to under, let's see if I can share this. If you go to the website, let's see, is this it? Here. And if you go to the website and you click on resources and you go down to wildfire response, you come to this page about wildfires, and then you can just click on either of these, and that will bring you to how to test your water. And down here, it tells you what chemicals to look for. It tells you how to take samples, but it encourages you to talk to the public health department because they would know what is specific to that area.
James is asking if you know, and maybe this is a question for you, Chris, do you know how many air monitoring stations are set up in Southern Oregon? I know of at least one there in Jackson County. Do you have any idea?
I know the one in Jackson County that I believe the county has established. Outside of that, I don't know that there are any other than the crews that are working on current projects. So for every EPA project, regardless of whether or not there's hazardous materials in there, if the EPA is in there doing the cleanup, they are running air monitoring both on the employees that are doing the work and what they call outside air monitoring. So they'll go anywhere from 10 to 30 feet away from the work itself. Whether or not that data is going to be published, I don't know. So we are looking into that with the EPA to find out whether or not we can access that information. But I think we're a little bit early in the game to get some of that from them. Once we do plan on sharing that information with everybody that is involved today, and anybody that has any questions from us. We can, once we have the information, we'll make it readily available to anybody that wants it.
Yes, that's awesome. This is Lisa again. As part of our project, we've applied for grant funding, sorry, to hand out what's called purple air monitors to individual families and teach them how to put these individual air monitors up in their homes or outside their homes. And so we can measure particulate matter as it is in the community real time. And all of those measurements are then posted to a website that anybody can access. So we're hoping to distribute those probably in 2022. And then also, if we can generate the amount of grant money, we hope to put some air filters inside of homes as well and test the difference between indoor air and outdoor air.
Thank you, Lisa. I'm also bringing back to the top or the bottom, I guess, rather, of the chat here. Helene shared a link where incidents can be reported. I think that's important to mention. She also had left a phone number, so I just wanted to bring that back there to the bottom. And does Purdue University website have language access in Spanish? Our interpreter is asking that, which I think is a great question for some of our Spanish speakers.
Yeah, I do not know. This is the first time I was asked that. So what I'll do is I'll contact marketing and media offices and find out how to answer that question. I'll get back with you.
Thank you. I think that's definitely an important factor, making sure that this valuable information is accessible. Okay. Anything else before we wrap up here? I'm trying to skim this. How many we got that? Yes, if you're listening this evening and you're interested in volunteering, in supporting any of these efforts, please reach out. You can contact uniteoregon.org and or beyondtoxics.org. I think Lisa put both mine and Erica's in the chat here, for, both of our email addresses directly in the chat there. Please feel free to reach out. We would love to connect with you. And if you are willing and able and want to support this, volunteer, things like that, we'd love to have you.